As a woman, a lovely mother, and an efficient wife, family and children are top priorities. As a working professional, balancing work life and home are high priorities too. As a daughter, taking care of parents is also equally important. And because of many roles women play, they are often focused on home, family, work, and busy schedules, while finding little or no time for the unique health need. Women's health does not refer to her physical condition but also to her total well being, and it is not determined solely by biological factors, but it is a combined effect of emotional and physical environment she is exposed to. It is extremely vital that a woman indulges herself in self care and self love to maintain good health and a positive attitude and enjoy a better quality of life. Simplifying wellness is a need of an hour. So, here I am presenting for the betterment of all women out there an ultimate guide to women's wellness. It's a precise session on which speaks about what causes illness in women, how does she present, and what are the precautionary measures to be taken either to abort or delay the disease process. So, hear me out and let's begin.
A very good afternoon to all the beautiful ladies over here and all the teachers over here. Wishing you all a very, very happy Women's Day. It's a pleasure and honor to be a part of this celebration today with all of you, and I genuinely thank Dr. Reshma for giving me this opportunity. I assure you that it will be time well spent and you'll have a value out of this session. So let's begin. And before I get into the details of the webinar, this session, I want to congratulate each and every one of you over here for maintaining a perfect balance life between your work life and your family life. Trust me, women, it is not an easy job because I can completely relate to all of you because I'm myself a working person. I'm a mother of a 10-year-old kid who is super hyper, super energetic, and equally challenging. I think many teachers over here would be knowing him so they can relate to what I'm saying. And I know how difficult it is to actually strike that right balance between your work life and your family life. So big shout out to you all, and you truly deserve this pat on your back for this. It is just not a joke to be a woman and to carry this multitasking. It requires a complete time management and multitasking. That's the reason we are able to do this. So I think we should give a big shout out for ourselves and pat the back for this. So before we get into the sessions, I would just like to tell you, let us all make a few commitments. Let us all be open over here so that we learn something from this session today. Let us all be very focused and concentrated. I'm sure you all have a value out of this session. And I would appreciate if you can silence your mobile phone for some time. And if you can sit with a notepad and a pen and just jot down something, whatever is important for you, whatever you can relate to. Because it is well said that even a simple thought or a simple idea or concept can actually change the way you're thinking. So just sit with a notepad and a pen and jot down whatever you feel it is relevant for you.
Teachers can jot down here.
Okay, yeah, that's the more technologically, more this, like, correct, exactly. And I understand as we move forward with the session, you might have some queries and doubts, but let's just maintain the discipline, let the flow of the session not be interrupted. I assure you, the last few minutes will give for the question answers. If at all you all have any doubt or queries, I assure you that I'll be answering all of them. And so yeah, be energetic, be focused, keep smiling because it gives me a lot of energy to see those smiling face on the other side. So I think we can start now. Okay, the agenda what I have for, I'm a medical professional. So agenda what I've set today is to make you all aware of or give you all an insight that what causes illness in women. And if at all women fall sick, right, what level she would present. One is at the level of the physical level suffering and one is at the level of the mind. I'll be talking in detail about it. What preventive measures can you take so that you actually don't fall into the trap of illness? And you will come to know the simple do's and don'ts which you need to follow. So before I get into the detail of the sessions, I would just like to give a small introduction about myself because there are few teachers over here who know me, but there are many faces who doesn't know. So I take your permission Mumbai and had been a gold medalist that time. After that, I've done my post-graduation in homeopathy for 2 years. Mind is a root cause of any problem. So it's very, very important to understand the psychology of a person, how the person thinks, what the person feels, because the person's thought and action, feeling actually determines his action. With this thought in my mind, I went ahead and pursued my diploma in counseling and health psychology. After that, I have worked as a school counselor in a number of schools. I have also conducted medical camp for pre-primary, primary children. Nutrition is ultimate importance in a life because a person is something what he eats, and hence with this thought in my mind and to provide my patient with this additional service, I went ahead and did my nutrition course from one of the internationally acclaimed institute, and now I help all my patients with the clinical nutrition diet plan. I also help my clients to help them achieve their fitness goal, be it weight loss, muscle gain, or muscle toning, whatever. And I'm truly committed to my work. Like I feel I give 100%. I treat my patient holistically, and I give 100% to each and every patient who comes to me. And I'm truly obliged that I'm into such a noble profession of serving humanity and transforming lives, which gives me an immense sense of satisfaction. I think that's enough about me. Let's proceed ahead. So as I said, when we say about women's wellness, when do you say a woman is well? Every woman has a right to enjoy the highest possible standards of both mental and physical health. So a woman is said to be well, a woman is said to be fit when there is a fitness at the level of the social well-being, physical well-being, and emotional and mental well-being. So there has to be a balance, there has to be a fitness at all these three spheres, which most of the time we neglect. And it's said that according to American Psychological Association, wellness is a term that refers to an optimal level of health and fitness that allows the individual to function actively and fully over full range of activities. That is what wellness is. Wellness also includes that how do we grow as emotionally, physically, spiritually, and mentally. There has to be constant growth in our life. Stagnancy is not supposed to be a level of fitness. So, let us now, I'm just going to take you through a small exercise. I'm taking you to the self-realization journey, because if you all realize that what is your health status, you will realize that if this is my health status, what measures I have to take to improvise it. So I'll make you take to this self-realization journey. What I'm planning to do is, I'll be flashing few questions, and you have to grade yourself. Where do you stand in this? Where 1 would be very severe and 5 is very, very rare or very not that severe. So you do not have to share your grades with me. What you will do, you will keep adding those grades as we move ahead with the question. And in the end, you will sum it up. Then we see how things unfold. So shall we begin with the self-assessment? Fine. The first question is, how many of you over here feel that you're neglecting your balanced, nutritious diet on the daily basis? We women have a tendency to eat leftovers. We have a tendency to eat what has been cooked for the family without actually giving importance that what is my liking, what is my desire, and maybe we are short of time, or at times we are bored to cook for ourselves because we are so hassled cooking for the family. And in the process, we neglect this balanced, nutritious diet on the daily basis. So how many of you feel that you're neglecting your balanced, nutritious diet on the daily basis? Grade yourself, maybe if 1 is very severe and 5 being very rare. So are we done with the question 1? Let's go to the question number 2. Okay, how many of you feel that you're suffering from some sort of recurrent health issue every now and then? Every few days you'll either have some acidity, you'll have headache, you'll have some joint pains, something or the other just keeps coming in, and you treat that problem for time being. It gets resolved, but after some time maybe that same problem comes back again, or something else comes back. So how many of you feel that yes, this is happening with me? I am suffering from some sort of health issue every now and then. Grade yourself, where 1 being very frequent and again 5 being very, very rare. We'll go to the question number 3. How many of you feel that you're suffering from some sort of emotional backlog which interferes with your daily activity? The emotions which is there within us, excess of anxiety, excess of fear, excess of sadness. It's to the extent that it actually interferes with your daily activity. How many of you feel, yes, I am passing through this phase right now and this is a problem with me? Grade yourself, again, 1 being very frequent and 5 being very, very rare. Question number 4. How many of you feel that you're deprived of good sound sleep for 7 to 8 hours? Again, running from here to there, finishing your work, finishing your family responsibility, you actually do not catch up with that good 7 to 8 hours of sleep on a daily basis. How many of you feel over here that yes, I hardly catch up sleep for 7 to 8 hours? Grade yourself again, 1 being very severe and 5 being very rare. Last, how many of you feel that you're the victim of social and family commitments? Either you are in a joint family where the family commitments are way too high, or there's a social commitment where actually fulfilling all this commitment doesn't allow you that me time for yourself. And as a result, you suffer in terms of the physical or mental problem. So how many of you feel that you are the victim of these commitments, where 1 being very, very severe, again 5 being very rare. So now add up all those grades wherever you know, at times it could be 2, at times it could be 4, so just add up all your grades and see what happens. If your grade is between 20 to 25, let me tell you that your health status, your physical and mental status is pretty good. And be happy about it and celebrate it. If your health status is between 10 to 20, then I would say your health and mental status is average. You can still work on it and improvise it. But if the score is below 10, I'm sorry to say, but you really need to be aggressive in terms of working at your physical and mental well-being. Otherwise, you would be suffering with some sort of problems, illness, every now and then without actually getting a long-term or a permanent solution for it. Now, what causes illness in women? It's a study which has shown that, worldwide, when the male and the female, they are born at the same time, the female is supposed to have a higher life expectancy than a male. Whereas in India, this is a study which has been done. In India, when they are born, a male and the female is born at the same time, they both have the same life expectancy. However, it is seen that over the years, the female die much sooner than males. That is only because women has a habit of neglecting their health over these years. And this is, though the life expectancy is same, this has caused them to die much more sooner. So the whole bottom line of this is that as a woman, let us take this charge of not neglecting our health, giving it the prime importance, the way we give the importance to the family members' health also. Now, the major causes of women's ill health in India, one is the inequality and discrimination in sex, which is there. The women are considered as a second citizen, and the males, that's the reason that culture is being followed. Obviously, the things are much better now, but then to somewhere this has been inherited in us. The culture has been following. As a result, we have developed this habit to give ourselves a second priority, which needs to be changed. A lack of balanced nutrition, lack of good sound sleep, the sleep deprivation, because sleep is a time when actually a person grows. Sleep is a time when body is in the repair zone. So it's very essential that we catch good sleep for at least 6 to 8 hours on the daily basis. Lack of physical activity. How many of you over here, tell me genuinely, how many of you over here devote that 45 minutes to 60 minutes of a day for your own physical activity? I can see a very few hands up, which is actually, that's good, which is actually very sad. Trust me, obesity is a root cause of all the lifestyle disorders. And this lack of physical activity which we have because of these commitments, the work commitments, the family commitments, we are actually inviting problems in our life. So it's high time we wake up and it's high time we take charge of this. Mental and emotional grunt. As females are obviously more sensitive, they undergo this mental and emotional grunt, and this in fact leads to the physical problem, and this is the cause of the physical problem. Now, when woman is not well, she would present either in the form of physical illness or she will present in the form of the mental unwell-being. But most of the time we neglect that mental unwell-being. I'm going to talk about it in little more depth because this is the area which I feel we completely neglected. If we have some problem at the level of the physical body, maybe the backache or maybe some joint pains, acidity, we immediately address it. But how many times do we actually acknowledge the mental emotional disturbances what we go through? Do we actually acknowledge it and we realize that yes, there is a problem with me? First of all, that acceptance needs to be there, that realization needs to be there, and if that happens, then the step to take ahead for that would come up. So that is one area I think we as a females tend to neglect it. Although women and men share the several diseases on the same plane, but there are few diseases obviously which are more prone with the females. So I'll just brief you a very, very brief overview so that you all know that these are the diseases common with us. So if we have to be more vigilant about it, just in case we come up with any of those symptoms. One obviously is the menstrual problem what the female faces is either a too heavy flow or a scanty flow or painful periods, that is a dysmenorrhea, or a premenstrual syndrome. At times it is so severe in female that those mood irritability, severe back pain, she has to take a break from her work, and there is something called as this polycystic ovarian disease, which is again a hormonal disturbances which leads to irregular periods in female, the mental irritability and all sorts of skin acne and eruptions. So yes, this is something which is again very common with females. Infertility, a burning issue with most of the couples now. And out of every 10 couples, 6 couples are having this problem of infertility. And the major cause is the lifestyle. The major root cause over here is the lifestyle, that habit of drinking, smoking, alcohol, and consuming processed food, emotional stress, and lack of physical activity. Definitely obesity and the problem like PCOS, polycystic ovarian disease, adds on to this infertility problem. Another burning problem is obesity. Obesity is the root cause of any illness. If you tackle this, trust me, you are inviting a much healthier life for your future. It's just that you have to be focused about it to tackle this problem. And the major cause of the obesity is the sedentary lifestyle, improper dietary habits, lack of physical activity, emotional stress, and disease like PCOS again adds on to it. So it's like a vicious cycle. Obesity leads to PCOS, and PCOS again will not allow the obesity just go off easily. So it's a vicious cycle which needs to be addressed. Another common problem is thyroid. Thyroid is very, very common in females. It is twice as common as compared to males. So when we speak, and it is generally seen in between age group of 18 to 35. And the major problems with when you have to think, if at all, can I have a thyroid? Do I need to see a doctor? The main symptoms which you need to keep in mind is either there is a too rapid weight gain, there is intolerance to cold, there is a low or depressed feeling most of the time in the day, you have a severe hair loss, the heartbeat is slow, you have a problem of constipation, the menstrual irregularity starts. Most of the time the females would have either missed periods or they would have scanty flow. So, and fatigue and lethargy throughout the day where you're not able to do your daily activity, you don't feel like doing anything, and joint pains. So if any of these symptoms have been persistent for prolonged time, think about it, get yourself investigated, you might be having a thyroid problem. And another common problem with females is urinary tract infection. That is because the females have a narrow urinary passage compared to males, so the chances of it getting infected is much more higher. And the main symptoms which will be present, it is very common, and you all would be aware that increased frequency of urination, or you would be burning by urination, and there is a pain either in your back or lower abdomen. If something like this is there, think about this problem and do get yourself investigated. Another major problem is cardiovascular. What is important over here? We see cardiovascular disease even in males is equally common. But the whole logic of putting this first, in cardiovascular disease only in females, it is seen that they do not present but typical chest pain. like how we normally have. Females, if they have some issues with the heart going on, they would normally present either with some neck pain, jaw pain, or they would have acidity for prolonged time, or they have this lightheadedness, dizziness, and unusual fatigue. So if this problem is there, either you're having acidity for a long time, do not neglect it. Acidity can be diagnosed when you rule out your heart problem. So it's a simple thing, you have to just go and get yourself investigated. If everything turns out to be normal, you have your peace of mind. But if something is detected, then early measures can be taken and the problem can be resolved in much more better way. Osteoporosis. This is another very, very common problem all the females undergo. I think all teachers over here would be in the age group, I think between 30 to 50, majority of them. Correct me if I'm wrong. Yeah? So around post 35, it's seen that there are hormonal changes in females. The estrogen level starts dropping down. And especially when you're nearing your menopause, the estrogen level actually drops down, and this leads to the depletion of calcium from your bones. The bone density goes down, and there is an issue of osteoporosis. Osteoporosis doesn't have any symptoms. One fine day, you'll just come down with fracture, and you'll realize that yes, I had osteoporosis. So the only way to prevent it is get your regular health checkups done, and supplement yourself with a good amount of calcium and vitamin D3. That is one of the major preventive things you can do to prevent this osteoporosis. And as I said, menopausal women, elderly women, women who are nutritionally deficient, who are taking certain sort of medications like antidepressant for prolonged time, women have a habit of smoking, and or either too underweight or overweight women, they are more prone for this osteoporosis. Once you're getting osteoporosis, the chances of you getting osteoarthritis is again very common. Like I remember when we used to study that the osteoarthritis was a disease of in 50, 55, the females used to come down with pain. But now even in 30s, the osteoarthritic changes have been seen in the bone level. That is again because this osteoporosis has not been addressed. That leads to the degenerative changes at the level of the bone, and you develop osteoarthritis. So typically it is those seen in 40s and 50s, but off lately I see patients, even in 30, 35, they come down with this problem of osteoarthritis, cervical spondylosis, very, very common. Breast cancer, another burning issue and very, very common problem the females have. And the major cause of it is definitely one is the family history. If there is inherited, so if you have the genes, then physically being inactive, use of birth control pills for a long time, and early menarche and late menopause. If you had a first period which is really early and the menopause is late, maybe after 50, during that time you have been exposed to those female hormones for a long time. So that increases your chance for breast cancer. No breastfeeding history because of any cause, or there is a prolonged history of smoking and alcohol. So what, as a female, you all need to understand is, when do you think about this grave condition? The simple thing, if you are detecting a presence of any lump in the breast, if there is a pulled nipple, there is a dimpling of nipple, or if there is a dripping of nipple, if you see some red rash around your breast area, or if you see certain skin changes, please do not neglect it, because most of the time, many times it is seen that if there is no family history, there is no obvious cause of the lifestyle being hampered, but then too this problem crops in. So if any of those symptoms are present for even some time, then be very vigilant about it. Get yourself diagnosed. If it's normal, trust me, you all have your peace of mind. Otherwise, things actually turn really grave. Another common problem is cervical cancer. Cervical cancer again is because of this human papilloma virus, which gets transmitted into the females via sexual intercourse. Many females have this infection, but only few go into the stage of cervical cancer. And again, the pointers for this would be the pain during sex, the pain in the pelvic region, unusual discharge from the vagina, and unusual bleeding, especially after sexual intercourse. So I'm saying the whole logic is not to make you all medical professionals over here. The whole intent, what I had in my mind, was to make you all aware of those common symptoms. If at all present, you need to address it. You just do not need to give a blind eye to it. Now coming to the mental unwell-being. As I said, this is a thing which is neglected by us because we do not acknowledge the fact that yes, something is wrong with me mentally, I need to address this problem. Because depression is one of the most common problems we've seen in females. Because being sad is a normal reaction to difficult times in life. But usually the sadness goes away with little time. Depression is different. It is a mood disorder that may cause severe symptoms that can affect how you think, how you feel, and how you handle your daily activities like sleeping, eating, and working. So if there is a disturbance at your daily activity level, wait, think about it. Why is this happening to me? Acknowledge it and work towards it. The major symptoms what a depressed females will pass through is they would feel depressed most of the time in the day. They lose interest in the pleasurable activities. They have low self-esteem. Many times they have the suicidal thoughts and they actually thinking about death. There is an experience in appetite. Either they go into binge eating or they completely lose an appetite. They have the sleep abnormalities where they are not able to sleep for the long time. They have very low energy levels. They either are very agitated and they move very quickly, or most of the time they are very fatigued, where there is disinterest in everything what was interesting for them before. And they have difficulty in concentrating and making decisions. So these are the pointers, if at all, this is present. Give a thought to it, give it importance, and yes, seek a help for it if required. Another most common problem is anxiety disorder. It is as severe problem as any of the physical problem like a heart disease or anything else. It is a problem where there is extreme fear and worry. The female keeps we all worry about our family members, the near ones and dear ones. But when anything is out of proportion, that is the time where you need to address it. So here there is an extreme feeling of worry, extreme feeling of fear. And the main pointers for it are you feel nervous, irritable most of the time in the day. You're on the edge. And you have a sense of this impending danger, or you panic in that certain situation. You have an increased heart rate, obviously because anxiety causes adrenaline to release, so you would feel that palpitations within you. You will breathe rapidly. You will feel very weak or tired. There is difficulty in concentrating. And you have trouble in sleeping where you are not able to get a sound sleep, or you get up suddenly in the middle of the night, again where you are not able to sleep again after getting up. You experience a gastrointestinal problem, that is frequent motions. You have seen that many times whenever we hear some bad news or something, we immediately feel like rushing to the toilet. That is because the release of adrenaline and that anxiety which is there. So female who is having this anxiety disorder would experience this recurrent gastrointestinal problems. Another common problem is eating disorder. Many females have this habit of eating without any reason. Like they are not hungry, but they would just eat. It is there in front of them, or it gives them the satisfaction. So think about it. Are you actually trying to resolve some of your frustration, some of the emotional backlog, and eating is becoming a medium for that? Or many times it happens the female goes into extreme where she doesn't eat, extremely conscious about the figure. She pukes and throws up after eating, so just in order not to gain weight. So eating disorder can be an extreme where one side you can be binge eating, and the other side you become absolutely anorexic where you fear to eat even little food. Now what preventive measures we can take? Preventive care means you can take the steps proactively to keep yourself from getting sick or to keep the sickness from getting worse. So if you take the preventive step, either you prevent the disease, or once the disease is within you, you prevent it from getting worse. And what are the simple ways of taking the good preventive care is you should know your risk factor. That yes, am I prone to this? First, it's very important that you know whether I have a risk of getting this illness. Have a regular health checkups done. You get yourself screened for cancer if there is a family history, and obviously practice healthy habits. This all would keep you away from disease to long extent. It is seen that regular health checkups and screening in combination with healthy diet and regular physical activity can assist in prevention of disease or illness. The appropriate screening tests are generally used to detect potential health problems when they are still treatable. That's the reason screening becomes very, very important. When I say about screening, I'll brief you all about what tests in what age group you should think about just to prevent yourself from getting into the trap of falling sick. Prevention is always better than cure. So if the females are between 20 to 40s, in my 20 years of practice, I have come to this conclusion: if you carry on this, I think you can abort majority of the disease in right time. One is get your blood pressure checked every 2 years, unless and until you have some symptoms. Obviously, immediately go and check your blood pressure. BMI, this is a basic metabolic index, which is again the sign of obesity. So get it checked every year and see whether you're actually falling into an obesity zone, normal zone, or you are undernourished. Your CBC, your complete blood count, thyroid profile to be done, lipid profile, which would tell you about the cholesterol levels, fasting blood sugar, vitamin B12 and D3, we are most of the time low on that. So it's very essential, especially after 30, at least once in a year, get this blood test done so that you can supplement yourself if you are deficient. Pap smear every 3 years, especially if you have a history of cancer in the family or any sort of a vaginal discharge. Screening mammogram, again there is a family history. Mammogram is the test which is done to screen the breast cancer. After 40, as I said, what happens is we go into osteoporosis, and the only test to detect this is the bone density test, which will detect the level of calcium and the thinning of the bone if it's happening. So you go and do a bone density test, serum calcium and phosphorus levels, which again would point towards osteoporosis or osteoarthritis. Vitamin B12, D3, pap smear again to detect cervical cancer if at all you have any symptoms or if there is a family history. Screening mammograph and pelvic and abdominal sonography just to rule out any silent problem like gallbladder polyp, gallbladder stone, kidney stones, fibroids in the uterus, many times cysts in the ovaries. All these problems are many times silently lying in your body. So it's always better to get this abdomen and the pelvic sonography once in a year to rule out any of these problems. Now after 50s, again you need to go for a complete blood checkup once in a year. It's mandatory. Bone density test, again abdomen and this pelvic sonography, pap smear and the screening mammography. Now as we have to go through the physical screening, it's very essential that we go through this mental screening also once in 6 months. It can be a self-screening, but you do the screening for yourself and ask yourself that, am I falling into this zone? Ask yourself that if there is excessive worry or fear, is there extreme sadness, whether there is a major change in my personality of eating habits or sleeping pattern. Am I passing through some dramatic mood swings? Am I having this excessive emotions like anger, frustration, resentment? Am I feeling fatigue and lack of energy most of the time in the day? Am I confused, thinking and making decisions and concentrating in my work? Do I have this feeling of guilt and worthlessness? And do I avoid social get-together, social activities? If any of these symptoms are persistent in you, yes, you have a problem and you need to accept it. If you accept it, you'll work towards it. Now, supplements what the females normally require are multivitamins, tablet vitamin D3, B12, calcium, which is a bone builder, fish oil, that is an omega supplement which would keep your heart and skin healthy, and tablet biotin, which is again tackles your skin and the hair issues. But please do not self-consult and start taking these medications. It requires a proper dosage, it requires a proper consultation. But these are the major supplements which I feel we females usually need to maintain a healthy life in the future. Now the 4 ways to boost your immunity and prevent you from falling sick is obviously a balanced and nutritious diet, uninterrupted sound sleep for 6 to 8 hours, good physical activity for at least 45 to 60 minutes, and last but not the least, a correct, precise homeopathic medication is known to be an immunobooster and is known to be a preventive measures it would not allow us to fall sick most of the time. And being into this practice from last 20 years, I can vouch on this that yes, homeopathy acts as an immunobooster. There There are many myths which is going on around this. Since being into this field, I would like to give you a short overview about this system, because this system actually has the power to abort majority of the diseases and give an answer to the chronic problem what we have. Homeopathy is a medical system based on the belief that body can cure itself. Here a tiny amount of natural substances which are present around us, like it can be a plant or an animal product, here they are potentized, triturated, and they are made up in the form of the medicines. And these medicines, when administered in human beings, they stimulate that healing power in us. Because we believe that a body can heal itself. It does not require the doses of medicine. What it requires is just the right stimulus. Now there are many myths, and even you all will be aware about many myths in the society which is going about this system of science. That one is it is very slow acting, which is absolutely not true. It acts rapidly and the effects is much longer. The all issue is it depends upon how long the problem is. If you are suffering from some problem for maybe years, to go it would take at least some time, maybe few months. But if you are having some acute problem, maybe acidity or maybe vomiting, headache, then to go it would not take time. So it's absolutely not a slow system of medicine. Homeopathy is not a medicine of emergency, which is again not true. It gives quick relief in acute conditions like fever, cold, cough, pneumonia, diarrhea, migraine, and we require no help of no other medicines. The problem can be resolved just with homeopathic medication. Homeopathic medicines cannot beat antibiotics, which is again not true. Infections like vaginitis, where there is a presence of vaginal discharge, urinary infection, where there is a documentation done, the pus cells are high. After giving the medicines, we again get it documented and all the counts are coming back to normal without the help of antibiotics. So yes, the medicine does have its own medicinal properties and it does not require the use of antibiotics. It cannot be taken by the diabetics because many people feel that the medicines are sweet to taste, so the medicines cannot be taken by diabetics. This is again not true because it is made up from lactose and not glucose, which is harmful for diabetes. And if at all the patient still has a doubt, they can take it in the form of the liquid form, which is again not sweet. Homeopathy is just a placebo. Many people feel that it works at the level of psychology. The patient comes, they talk, we give the listening ear. Majority of time this problem is resolved with that, which is absolutely not true. Because over years that we have observed millions of cases getting wonderful results. So every time it just cannot be a psychological effect. Or they say that it contains steroid. That's the funniest part. If the medicine shows its effect immediately, so many patients would have come and asked and confronted me, "Madam, आपकी दवाई में steroids है, ये कैसे solve हो गया है?" इतने टाइम से हम लोग दवाई ले लेते हुआ नहीं. Which is again a myth. It does not have steroids because steroids are bitter to taste. Homeopathic medicines are sweet to taste. So it definitely does not have any steroids in it. Neither it is a placebo effect. It has its own medicinal value. Rather, it has ample number of advantages when women takes it for the long time. That is, first it would correct your hormonal imbalance. In allopathy, sorry to say, but the answer is only those hormonal pills. And tell me for how long can we take that? So it is definitely hazardous. It corrects the hormonal imbalance. It takes care of the mental well-being like depression and anxiety. There are no adverse effects seen. It prevents the recurrence of complaints and is ideal for any chronic ailments and treats the woman as a whole. As I said, it's very important to strike that balance between the mind and body. I would not take a patient as a patient of constipation or patient of acidity. The patient is as a whole, where the balance needs to be struck between the mind level and the physical complaint. And that's what homeopathy does. It treats the patient as a whole and not in parts, not in the form of a disease which they have come to us. Let's see what these few women have got to say. The whole logic is not to brag about myself, the teachers. The whole logic is that being into this system, experiencing this system, I can vouch on it and I'm here to create that awareness that if at all you all have this chronic problem, you all have some underlying recurrent problem, this system has an answer for it. So you can look forward to it and get your problem resolved. This is a girl who is 16 years old. She was suffering from irregular periods, which is very common during the menarche. After the first periods, some females come immediately, some females maybe after a year or two, they would have these irregular periods. So she was the one. Can we play this from there? I think we need to just start this. Irregular period, young girls who have this problem of irregular periods, and it is really skeptical to give them those hormonal pills for a long time. So she had actually beautifully recovered with this homeopathic medication. Can I have the mouse? She's again a case of a girl with PCOS, polycystic ovarian disease, which is very, very common in females, young females, where they are having this irregular or skipped periods. And again, the homeopathy has a very good answer to this. So she had just shared her experience, but unfortunately, I think we are not able to get it. That's fine. She's a lady, yeah. She was the one who had come to me with a skin complaint. The whole intent of bringing you over here is because when she came to me, she came with a skin complaint. And actually the problem was the mind. She was undergoing depression, which she did not realize. After actually talking and giving her a listening ear and making her say her suffering, she realized that yes, something is wrong with me at the level of the mind. And when that was treated, her skin resolved on its own. So that is what I intend to say, that we need to treat everybody holistically. And that's the whole logic. I have named my community also as a holistic lifestyle hub, because it has to be a person as a whole. You cannot divide a person. So she responded very well. Even her depression resolved to a very good extent. And she was a lady who had come to me with this anxiety disorder. Same problem. When she came to me, she had extreme fear, nervousness, panic. She didn't know that actually there is a problem at the level of the mind. And that is why we need to be more vigilant about when you pass through these emotional disturbances. Again, I made her realize, this is what she said, I suffered from anxiety since last few months. Anxiety increased to such an extent that I felt nervous most of the time, low on energy levels, and used to weep despite of no big reason. I visited Dr. Rajshri and she recognized the symptoms and helped me diagnosing anxiety. And within 2 weeks of treatment, I started feeling much more in control of my emotions. Her reassuring words and positive affirmations has also helped me to stay positive. So she was the one who was suffering from mental symptoms but not able to recognize. So what do we conclude from this? Women, you all are the real architect of this society. So please do not neglect yourself. Give yourself that due priority, work for it, and don't overlook your wishes and your desires. Be active, be vigilant about even the minor changes taking place in your body. If they are persistent for the long time, do not hesitate to address it. And take care of yourself, love yourself, so that you can take care and love your family members in a better way. So I would love to stay connected with you all even after this session, because it's really nice to be connected with the lovely ladies and all the people. So you can stay connected with me on the Insta. You can follow me on the Instagram. That is my community, I said, as it is, it's a holistic lifestyle hub. My Facebook page would be Holistic Lifestyle Hub. And you can also follow me on my YouTube channel, that is Holistic Lifestyle Hub. Even this session I'm planning to put soon on this channel, so that it becomes a memory for me also, that I could be a part of this great celebration. You can also get in touch with me via my website, that is drrajshripandyar.com. So yes, as you all are teachers and you all have a habit of giving homeworks to all your students and expect them to do it, today I am going to give you all an assignment, and I expect that from today you are going to do this assignment religiously, and the assignment will be eating a balanced, nutritious diet on the daily basis. You will be giving that good enough exercise time for yourself. You will sleep for at least sleep for 6 to 8 hours a day, and take a break from your daily routine at least once in a week. Do something that you really enjoy. It can be of any physical activity, it can be dance, it can be any hobby classes. Forget you are a mother, you are a daughter, you are a teacher. It is just you. Give that me time to yourself. Trust me, that me time would take you long way. And spend your time with your friends. I think that is the ideal time where we actually distress ourselves. So yeah, once again, thank you so much, teachers, thank you so much, ladies. And I once again thank Dr. Reshma for giving me this opportunity. It was awesome to be a part of this celebration today. Thank you so much. I would just like to share my journey of my transformation journey, what I had undergone last year around same time. It was a challenge which I had participated. It was a transformation challenge where I had to transform myself in 12 weeks. And it was a global challenge where 22,000 participants were there globally. And amongst that, I stood second as a first runner-up. And I won the prize of 2 lakh rupees and a Garmin watch and shoes and all that. So it's a memory for me, and since I'm a part of this celebration today, I would love to share that journey with you all today. So here it goes. Yeah, sure. Yeah, meanwhile, any one of you have any questions regarding your health or you want to just ask anything, you can do that now. Be a set example for what you say or what you preach. Because if you are a live example, people will believe in what you say. Like if I tell my patients, fitness has to be a part of your lifestyle, I have to depict what I say. Hi, I'm Dr. Rajshri Pandya. I'm 42 years old, and this is my Transformation Challenge 12 story. And as a teenager, I did suffer from asthma because it's a family history. My father is an asthmatic, so I used to have asthma at a very severe grade. I was always an athletic, like be it running, be it jogging. I would love going for marathons. College yet took a backseat. There was a lot of studies, being into medical field. So I was completely into my studies. So all these activities definitely took a backseat that time. And obviously that exam stress, studying stress. That time my asthma attacks were more frequent. So I was suffering from that. I have gained maximum amount of weight in my pregnancy. Like it was 25 kgs. I weighed almost 90 kgs when I went last for my delivery. 29 December, I still remember I gave a call to my coach. His name is Bhaskar Taryar. And somewhere, when you call up somebody, there's something where you can connect with somebody, and that is what I found with him. Being a vegetarian, he gave me a complete vegetarian diet, a high protein diet. There are enough food sources, whole food sources like soya, paneer, milk. If you're consuming good amount, your protein requirement can be accomplished. Workout wise, it was upper body, lower body, abs every day for 6 days a week. So around October 2020, I started with my weight training, because that was a time when everything around was closed, because I was into yoga, I was into aerobics, so all this workout was closed because of the pandemic. And my building gym was open. So that is the time I thought, let me give a try. When I decided to part in Transformation Challenge, everybody, my close relatives, even my husband used to tell me, what would you transform as? You're already so lean and thin. Transformation Challenge is a 12-week process. So when you have a set goal that in that 12 weeks you want to reach some destination, that would be a more defined journey. I could see myself the difference every week. Like, there is inches which is happening. I could see my pants getting loose. I could see my muscle definition, the toning of the body. And every week the progress was definitely visible. And that keeps you motivated. Out of 22,000 participants globally, holding a first runner-up place, it's a thrilling moment itself. Obviously, the recognition what you get is at a different level now. People want to know exactly how did it happen, and they want to incorporate the same routine in their life. The level of confidence I have with this science and the confidence I have to help the community with the science is at altogether different level. The science on which this fitter is standing, calorie calculation, it's maths, fat loss which happens because of it, is the science behind it. So maths and science can never go wrong if it's been executed properly. Trust the process, trust the science, and give your 100% to it, and the result will be at your will. The whole logic behind this is I want to see still a better version of myself and how better I can be, because even I didn't know with this TC12 I would reach at this level. So I don't know with TC13 and TC14 where would I be. So I'm very enthused to see that version of myself now.